Hello, and welcome to the Fearless Podcast, where we empower Iowa women to succeed in work and life. I'm one of your hosts, Emily Wood, joined by co-host LaDrina Wilson, Fearless editor Macey Shofroth, and some very special guests. Today, we're going to be talking about childcare. There's a lot we could discuss, from the systemic level, childcare quality, affordability, availability, but there's also the very personal level, how decisions about care impact parents' careers or their personal lives. And we know that women are often primary caregivers. So for those with children or those who want to have children, those decisions are often affected by their financial situation, their own desires to spend time with their children, their career goals, and many other factors. So today we're going to have a segment with a broad look at childcare in Iowa. And then we've lined up some guests who will talk about their own personal decisions with caregiving. So LaDrina, before we bring our guests on, let's talk a little bit about why this issue matters.
Yeah, I think it's incredibly important. I want to go back to one comment that you made kind of in that intro, is the decision affects financial situations and whether or not you want to spend time with your kids. And for some people, they don't really even feel like they have a choice. They have to work, right? Now, one might say, well, you chose to, grow your family. But we also know that life can be very complicated and complex. And so for those people who do get to make some choices, that's great. But for a lot of people, they may not have the choice. And I think even some of those choices even assume that there's a partner that's in the picture, right? And so if you're doing it alone, you definitely don't necessarily have the same amount of choices that someone who does have a partner has. But when I think about why childcare should be important to all of us, really is because it's not only a personal or even like family quality of life issue. It really is an issue that intersects with economic mobility as well as the workforce. I can think back to my own experience, and my mom helped me a little bit, even though both my husband and I had professional positions. Like, it was expensive. Childcare was incredibly expensive. And my kids went to it wasn't like highly selective or anything like that, but it was a basic daycare. They got great care and great quality, but it was one of the more affordable options. And it still was a little bit out of reach for us early in our career. And I think the other thing that stands out to me when I think about childcare, in particular as it relates to women, it's no secret that I served as the CEO for a Chamber of Commerce here in my area. And I can't tell you the countless resumes that I saw where women were talking about how they stopped out, or, as they're transitioning back into the world of work, and making that decision to stop out impacts you financially. But I think about it as like, right, there's that deferred income piece, but there's also like the wealth building piece. Like, you actually have many, many years where other people maybe are accumulating wealth and building their income. And I think that we lose sight of the fact that absent childcare, people don't even have the option to go into work. So for shift workers, especially people who are working second and third shift, they don't get the option sometimes because, like, there's a shortage, not just a shortage in like proximity, but of providers. And so it's a really important economic issue as well as a family issue. And when I say family, I don't just mean, a husband and wife or two partners who are growing a family. Like, we had to engage our extended family to get the support that we needed to make it through and to get by. So I think it's important for all people to really like tune in and recognize that this is not a unique challenge. It really is almost universal.
Yeah, I think when you mention all people understanding this as a universal issue, when we do our annual survey on gender issues in the state, there's inevitably always a couple of comments. I'd say the vast majority of people agree that childcare is an issue in the state that needs to be worked on. But there's always usually a couple of comments of people that don't understand why a workplace might be striving to have childcare benefits or parental leave, discussions going on, because maybe they themselves are out of that phase of life with caring for children, or maybe they don't ever plan to. But I think what I hope we can talk about today is how this affects all of us in the economy and workforce in general, and be able to just talk about it, as you said, from that universal standpoint. So many that are listening may be nodding along that with some of the experiences you mentioned, that, childcare is something that they've navigated. Or maybe, again, you're listening as someone who wants children someday or somebody who doesn't ever plan to have kids, but we hope to kind of address all of those perspectives. But just to tee this up a little bit more, here are some numbers as it relates to childcare in Iowa from the Iowa Women's Foundation. So 3/4 of Iowa children under the age of 6 have all parents working outside the home, which makes quality and affordable childcare extremely important. And 63% of parents say that childcare costs influence their careers. So back to that financial aspect.
Mm-hmm.
About 1/4 of Iowans live in a childcare desert. So one of our guests today is going to talk about rural childcare in particular. But at the same time, childcare workers are among the lowest paid professionals. So these are just some of the challenges at play. There's a lot to discuss. So we want to bring on our guests.
Could I ask a question before I bring our guest on?
Yeah.
When you say childcare desert, can you kind of describe that for me?
Yeah. So the inability to have childcare directly in your area. So that the spots in the state where people might have to travel quite a ways to get childcare, or there's such a small number of slots in their area that they, their childcare in their town might not even have availability at all. So they might have to travel 15, 20 minutes. And of course that affects their jobs and financial decisions too. So
access isn't always even accessible if there's a limited number of slots.
Yes.
Available. Okay. Thanks for
Yes, definitely. So today with us, we've got Claudia Schabel, who serves as the interim CEO of the Iowa Women's Foundation, which among many issues focuses on addressing childcare challenges. In her roles as a business owner, employee, and volunteer, Claudia has a passion to build workplaces and communities that are intentional and effective in their efforts to ensure that everyone can thrive. And we also have Kristy Turner, the founder of Mindful Solutions and Mediation LLC, and the former executive director at Postville Childcare Services. As the former childcare center leader, she worked directly on implementing the Childcare Solutions Fund in her community. So we'll talk more about that. So welcome to both of you.
Good morning.
Hi, thanks for having me.
Awesome. So Claudia, wanting to start with you,
Sure.
Whether, there are parents tuning into this, or again, those who don't, have kids or plan to, why should people be thinking about childcare issues in Iowa?
Yes, again, thank you so much for having me. It's a pleasure to be here with both of you. And I think you and LaDrina set the stage pretty well for this conversation already. The way I think of childcare issues is not only a workforce issue, it's also an economic development issue, but also a community issue, right? Often when you think of childcare, historically, we like to think this is a parenting issue. You have a child, you find someone to care for them, and then you show up for work. But it's all intertwined. And we have seen this firsthand given the history of the Iowa Women's Foundation. We know that if a parent is relocating, looking for new employment, the first thing they're going to do if they have children or are planning to have children is, what are my options? How affordable are they? And more importantly, is it a quality option? Because it's not enough to have childcare. It has to be affordable, quality childcare. And we can talk a little bit more about that. But I think this whole mindset needs to shift, that even if I don't have children, if it's still a part of my community, it impacts me. And there is a ripple effect, right? We know if a parent with a child that doesn't have necessarily reliable childcare, you will know that parent is more likely to miss work. It's more likely to then decide, if it's not affordable, I'm going to stay home and take care of my children myself. And often those decisions, unfortunately or fortunately for some families, end with the mother or the female partner saying, I'm going to stay home. It's maybe cheaper to stay home. It's more reliable and safer for us just to have one of us staying home with the children.
I really appreciate this idea that even as it relates to economic development, and I think that people don't always recognize, when businesses choose to relocate, they're looking at the skills of the workforce. But then the workforce is looking at what that community looks like for them. And so it becomes this kind of quality of life issue, and they're all very much intertwined. So thanks for really driving that point home. Now, Kristy, I know you have shifted your line of work recently, so really excited for you there. But you have an extensive background in the realm with many years of experience in childcare. What made you find that work that you were doing in the childcare area interesting? And tell me a little bit about your background as it relates to that.
Sure. Yes. Thank you for that. And before I answer your question, I want to build on the momentum here we have around the topic of why should we care? Because that came up a lot for me as I was campaigning, as we were campaigning for the Child Care Solutions Fund. So a lot of the pushback naturally is what about people without kids? Why does it make sense for them to invest? Well, even if you don't have children, you rely on people who do. Nurses, farmers, teachers, manufacturing workers. Childcare affects everyone. Not only that, we partnered with a local manufacturing plant in the community, and their president spoke to this. They really help our economy. We're a small town. They really help our local economy, and they chose to invest in a pretty significant way, largely because they had a open position for an engineer that they just couldn't fill because people needed to look at the community they were moving into in order to accept that position. So I think this conversation is really important, and I just wanted to add that piece before I moved on. Now, why I chose the when I applied for the director position, I was already a parent there. So my two children attended the center. I was a parent before I worked there, and I saw the work that these teachers did. I saw the love and the care and the collaboration with me as a parent and the care that my children received. And I wanted to be in a role where I could support them. So that's really what brought me to the position.
So you're talking a little bit about, being able to observe firsthand what it was like for these childcare workers. And we know what I find interesting about this is we have like the shortest term memories ever because we all were impacted by COVID, and all of a sudden all of us have this reckoning. We're like, wait a minute. This is what people are going through. And even if you were not, in the home with your children, you still saw on your Zoom calls with your colleagues, like juggling all those responsibilities. And I remember distinctively being like, I'm so glad that there are people who do this work because I'm a better mom because they're able to be with people who are really good with kids this age. So thank you for like observing that and then like rolling up your sleeves and getting in there.
Yes, it's so true. And once I was in that role, I saw how fragile the system really was. I had teachers who loved the job, loved the kids and the families, but couldn't afford to stay. I knew I had to tackle it from a wage perspective so that way I could support my teachers' financial safety. They could show my theory was if they felt more financially secure, they could show up in the role in a secure way. I had one teacher come to me and say that they loved the kids, they loved the families, they loved the job, but they couldn't afford the gas money to get to work.
Hmm. Yeah, with them being one of the lower paid, industries, it's pretty amazing that we have so many people who have stepped up to be, childcare workers. I'm gonna go a little bit off script here, but it seems like a natural kind of progression. Since you were talking about observing their day-to-day functions and what it looks like for these, childcare teachers, can you tell us a little bit about what that role entails?
Absolutely. And each age group comes with its unique approach, but overall, childcare teachers, they aren't just supervising children. They create structure and rhythm because predictability builds safety. They serve CACFP regulated meals. They sit with children to model healthy eating habits. They plan developmentally appropriate lessons for every age, even infants. They individualize learning using milestones and parent input and support social and emotional development and prepare children for school. Because, we sometimes forget this work is to help children between the ages of 0 to 5, targeted, we targeted specifically 0 to 3. So much brain development is happening at that time. so much happens before kindergarten. And I know that's why the teachers that worked at the center were so passionate about the work, because we were brain architects. We developed lesson plans that supported development, healthy development, so kids could be prepared for life and prepared for school.
I love that, brain architects.
Yeah.
Use it later.
Yeah.
I love that too. That's amazing. Thanks for
Yeah,
that.
it's great to kind of hear about that individual perspective and remembering that very specific community impact. And Claudia, now the Women's Foundation is charged from looking at this at a statewide issue. So not just that individual experience of parents or communities or centers, but what is the Women's Foundation focused on right now with childcare issues across the state?
So let me just give you a little bit of history on the Iowa Women's Foundation when it comes to childcare, and then I'll fast forward to today. Since a research came out in about 2015, where the research talked about the fact that there were a lot of barriers to women's financial mobility, economic self-sufficiency, the Iowa Women's Foundation grounded its efforts on data and really that financial mobility conversation. This national research became then a statewide research called She Matters Report. It was actually a collaboration with many organizations here in Iowa, Chrysalis Foundation and many others. And that report then guided some community listening sessions, focus groups, and conversations to find out directly from Iowans, what is it that's holding you back? And in that those conversations, in that process, childcare bubbled up to the top as being one of the major barriers for women in Iowa. Many communities. There were 18 communities that the Iowa Women's Foundation visited for this specific conversation, and consistently, childcare came up as a barrier. So since then, let's say 2016. Between 2016 2018, that's when this development of more of a focus around childcare started. And fast forward to 2024, in the fiscal year of 2024, that's when we saw a major advancement with the pilot communities, which was the Child Care Solutions Fund. And this program really enabled the Iowa Women's Foundation to then be at ground zero providing technical assistance, much like what Kristy was talking about, is really helping communities come up with solutions that serve them best and really sharing those solutions across the state, because we're having the opportunity to learn from each community that we visited. The engagement started with about 45 communities and went up to over 80 communities that were trying to figure out for themselves what are the best solutions. But it came down to really a very basic, I think, understanding is that in order for us to solve the child care problems that our communities in Iowa experience, we need a public-private partnership, which is really, we need funding from our government and we need our friends in our communities, all of them to chip in. So, and we saw a huge success with that process, with that approach of a public-private partnership. We saw that many communities in Iowa engaged in those approaches. We had 9 communities that we have been tracking the data, the information, the best practices, and their successes. So that is how the Iowa Women's Foundation, up until last year, 2025, was helping with this conversation, providing that technical assistance. Today, 2026, our role has evolved a little bit. We continue to be a partner. We continue to be at a table having conversations about childcare. But for now, our role is going to be more from an advocacy perspective. It's really lending our voice, lending our expertise to how we shape policy and funding policies in the state of Iowa.
Yeah, and I know, Kristy, that when you were leading the Postville Child Care Services, you participated with the Child Care Solutions Fund pilot program. And as Claudia mentioned, that was the state-led public-private partnership. And so you all use those funds to help implement wage enhancement. And so essentially that ability to subsidize the wages of your workers so that they could make more. So can you talk a little bit about what that meant for you and for your staff and to be able to do that?
Yes, I can. Thank you for that question. And I want to start off by saying when I got into the role, I wanted to come into it with curiosity, and that's just how I carried it through. So coming into each situation with curiosity, wanting to understand the root cause. Now, we know parents pay a lot, and there's still a gap. So, through our partnership with the Iowa Women's Foundation, part of that process was we opened our books. We invited prominent business leaders and community leaders into our business, looking at our income statements, looking at our cash flow statements, and we all came. And we also have a well-respected, credible accountant who partners with us. Our our treasurer on the childcare board is the county attorney. So very respected individuals looking at this, wanting to figure out why are parents paying so much and yet why is there still a gap? Well, it, our biggest costs are food, overhead, and payroll. And there really isn't a lot of wiggle room. We can't scale the way other businesses scale. There's ratios in place to protect safety, to protect children, to protect teachers. So the way other businesses could scale is just not a way we could scale. So we had to look for other options. And I remember where I was the day I heard about Iowa Women's Foundation. I was sitting in my hair salon and a part of the childcare business incentive webinar, and I heard about the Iowa Women's Foundation. I'm like, I need to reach out to them. And so I did, and it changed everything. It started a chain of events that led to such a wonderful opportunity for our center. Sherry Penny provided technical assistance for me for the center. And what that really came down to is she gave me really practical tools that I could go out into the community and talk to them about what was going on with the same amount of curiosity, sharing with them information such as we are a childcare desert here in our county. What does a childcare desert mean? Well, it means for both working parents outside of the household, children between the ages of 0 and 12, we have one spot available for every 4 children. So we are running at quite a deficit. Families are feeling that. The workforce is feeling that. The economy is feeling that. So we need to come together, and this is how we can come together to solve this. And with that information, of course, there's questions about sustainability. There's questions about how can this help long term, and I respect all of that, and I think those are really great questions. Also, though, we have to solve the crisis now. So what are some things we can do? And when we were invited to participate in the pilot program for the Child Care Solutions Fund, um, I reached out to Val Renke at Economic Development. She brought in someone from Upper Explorerland, and together we just assessed the data and went into the community and let them know what was going on. And people showed up. $5, $10, $100, businesses coming in, and it just built momentum. And what really helped us build momentum was the fact that we could say, and the state is going to match this too. The state is part of it too. Because for a small community, there's not a lot of money. There's just not a lot of money. And we have small businesses that are also struggling. So I remember being part of a city council meeting. They called for a special budget meeting to see if they could help us. And they went through everything, and there just wasn't, they were talking about taking money away from the local police force, just things like that in our small community. It was really informative for me, and it helped me understand it from that level. People were doing what they could, and our city council members stepped up and they supported it in ways that they could. Now, what that meant for us, what did that do? It changed everything when it came to stability. Beforehand, I had teachers coming to me, they just couldn't afford to stay. They had to go to another job that offered them more financial stability. But after I could increase their wages, they stayed. Not only did they stay, they invested in the work. they wanted to learn how to become quality childcare providers. Not that they didn't want to do that beforehand, but now they were just really invested in it because I think they saw the community cares about me. The state cares about me. They want to invest in me and this work. And so I'm going to show up too.
Yeah. I think the interesting thing in all of this is there's all of these points of intersection, but many times the system is looking at it from a very disjointed kind of lens. And when I hear you say what you're saying, you've got people who are brain architects who are making wages that they could actually go to places, and this is no judgment, but you can go to any retail place and make more money and require less brain energy or thought leadership and not have the responsibility of caring for our most precious people in our community, right? So it doesn't, from a logical perspective, it does make sense that, it should be an all hands on deck type of approach because it just doesn't add up. So when I look at it and I think about what some of the priorities are for our state and our residents in our state, people do want to grow our economy. People do want to see, a vibrant community that grows and thrives. People do want to support education. Childcare is the precursor to education, right? And I also think that we would be hard pressed to find people that would argue that people should have livable wages. Now, we might define that differently, but I also am sensitive to the fact that many of the people that we're referring to who are in these childcare worker positions are women, and we disproportionately earn less money. And so I think when you look at it from this, you guys have offered a solution, a method that you have used to try and, combat some of the issues, but all of it's very reactionary. And if we know that we want to grow our population, which is part of growing your economy, then you need to be prepared to meet the needs of the most vulnerable, which are our kids, right? And so it's common sense, but at the same time, there's some business pragmatics that have gotten in the way of us just doing what I think is the right thing. We as Iowans used to pride ourselves as being among the top in the nation in terms of education. And I don't think it's by coincidence that we're having some of the childcare struggles, but also seeing us move down the ranks in terms of education in the country. And so I hope that our listeners, our community members, those business folks who maybe haven't seen themselves as part of the solution are able to be better positioned to step up. Public-private partnerships really is the way for us to be able to create an inclusive community where all people can thrive. It doesn't just come from the individual. It doesn't just come from the government. It comes from those employers also stepping up and being part of the solution and utilizing their resources that way. Because ultimately, those kids that go to preschool or that go to childcare and get preschool are going to end up in the workforce. So if you look at it from that perspective, you're kind of priming the pump and getting them ready to come into your place of business. Ladies, I really thank you for coming to have a conversation with us today. This has been enlightening. And as someone who is on the other side of this, I've made it through. I remember thinking I was going to be rich when I got done paying for diapers and childcare. I was wrong. Still very rich in love and enjoy my family. But I recognize that the costs have gone up astronomically, even since I had kids who were in that position. Claudia, it looks like you have something.
Yes, just parting words. Thank you for having this conversation and thank you so much for wrapping it up so well. I want to recognize the investment that the Department of Health and Human Services has made with the ARPA funds for the pilot programs. I know there is a willingness and commitment personally from a lot of those professionals. It's just a question of political will right now. And on that note, I want to recognize that our House representatives have done a phenomenal job in prioritizing childcare this year in the legislative session. So watch for all the 9 bills that involve childcare right now. And the Iowa Women's Foundation has personally been involved in really framing that conversation around the public-private funding. So House File 217, watch for that. We're rooting for them. So
Right.
thank
Well,
you.
thank you for your advocacy in this space. I think we're going to shift gears now, and Macey's going to actually talk to some individuals who are what I would call boots on the ground. They're closest to it. Their families are making different decisions about what's next or what they chose for their kiddos and their family in terms of childcare. So, Macey, I will turn things over to you. Welcome.
Yeah, thank you, LaDrina. As LaDrina said, we wanted to talk about both, the policy side of childcare, but also get some insight from real families who are making these decisions and kind of feel like what that tangible impact is. So for our Fearless Focus today, we'll be sharing these real stories from real mothers just about how they've navigated all of these choices and what's best for their families. I'm really excited because I get to kind of share my own perspective in this conversation. I am expecting my first child, a boy, in March. So my husband and I have been considering childcare decisions for months now. We've considered, keeping our son home with us because both of us are able to work from home, or sending him to an in-home daycare provider in our town. And there are also a couple centers we considered. We've also have to decide if we want to do full-time daycare or part-time and what that looks for both our schedules and for him. So I am also joined today by two wonderful guests who are also mothers. Anna Squier is an associate principal and architect with MA Architecture in Des Moines, where she works on community-focused and innovative design projects. She is also a member of the 2025 Business Records 40 Under 40 class. And she's married to Ryan, and they have two kids, Jackson, who is 5, and Madison, who is 3. And we'll also be joined by Natalie Mahoney. She is a first-time mom, fitness instructor, and Des Moines native, and holds an undergraduate degree in public relations from Iowa State University. And with over a decade of communications and public relations experience, she chose to pause her work career to take care of her son, Henry, who she shares with her husband, Ben. So ladies, thank you so much for being here with me today and talking about this topic. I know from personal experience, it's really a hard topic to talk about sometimes. So I'm glad to have you guys here. Let's get started with you, Anna. Can you kind of share with us what you decided to do for your childcare for your two kids and kind of how you arrived at that decision?
Yeah, absolutely. Thank you for having us here today. I think we're both in the throes of these discussions every month or every day about what's best for our kiddos at certain points in time. So since starting a family, we've had different seasons of childcare, and all of those timelines or decisions have been based on our financial goals or financial impact, career goals, what we think is best for our kids. Right now, both of my kids are in full-time daycare. When I had my first son 5 years ago, it was the height of COVID. So I ended up staying home for about 6-7 months. For kind of multiple factors. One, it was a scary time and my first kid, and I was nervous about sending my baby off when kind of there were all these big unknowns in the world. And two, availability. The center, we live in Norwalk, which has some really great daycare centers, but the center that we wanted to enroll him in, it didn't have availability until that far out. I think we all know availability is an issue, and we witnessed that firsthand. So I stayed home for about 6 months, and then he did go to a daycare center. And we made that decision for many reasons. One, both my husband and I wanted to work. We're passionate about what we do. And we had reached a point in kind of both our career trajectories where we were taking on leadership roles, and we were both anxious about what would that mean if one of us left our careers. We both also grew up with 2 working parents in our family, so I think it was ingrained in us that that's what you do and you figure it out. And also the social aspect of having kids and kind of the educational benefits. At a certain age, we wanted our kiddos to be around other kids just to get that social interaction, and also the developmental programs and everything that comes with that. So they're both in a center. I worked full-time 5 days a week with my first kid. And then once I had my second child, there's more obligations, 2 under 2, just more hands or less hands to take care of, more little feet type of thing. So we made the decision that I would step back and work reduced hours to take care of not all the child care, but more obligations of child care outside of kind of the educational day-to-day when they're in school. So I manage the sick days, I do pickup and drop off. I have that flexibility to just kind of manage the unknowns and those other obligations.
And then Natalie, so you went a different route and you decided that you were going to stay home with your son, and that's what was right for your family. Can you share with us just what led you to make that choice for yourselves and for your kid?
Yeah, well, first I just want to say thanks so much, Macey, for having us on here too. So essentially, I found out I was pregnant, and I obviously had 3 options. So the first option would be full-time work, sending my child into a daycare facility. 2 would be a part-time, which would be kind of like my ideal, which was what I wanted. However, my previous employer was not able to provide that option. And of course, the third one would be being at home. And we started already kind of doing some of our own research too. When I initially kind of wanted to be part-time, if that was an option, we explored some daycare facilities. I would have to say that even part-time wasn't as common for daycare facilities as well. So that was definitely a challenge. And then obviously when the time came and that option wasn't available for part-time, I had those 2 options left. So, and I really kind of hit more home when I actually gave birth. And I just knew that obviously, even from a full-time capacity, that childcare wouldn't take out the whole budget there, but I would say it's still a decent chunk. And the rest, I look at kind of even those keywords that Claudia was mentioning, to like reliability, being able to be present for my child when my child got sick, taking my child to the pediatrician, being able to run all those errands. And there's just so many other factors. I wouldn't even say it's necessarily coded as financial, but more of just being able to look at those additional things that some parent has to manage regardless of the situation. So I just felt like it was best for our family for me to be at home, especially since my mom was more of a stay-at-home mom. That's kind of like what I was used to as well. And, even looking at it from my husband's perspective, it was a little bit easier for him to be fully focused with his career as well, where he didn't have to worry about stopping work and picking up the kid from daycare or something like that. Like it's just an easier, clear cut line for my husband to work on his career and for me to be able to juggle my son 100% of the time. And that was best for our family.
That makes sense. And both of you, Natalie, you just mentioned budget as an important factor. And Anna, when we talked earlier last week, that you mentioned that as well. That's something that I've experienced that's really impacted our decision as well. And I didn't realize that you live in Norwalk. I also live in Norwalk.
Oh, you do?
Yeah, somehow that didn't come up when we were chatting. But like you said, there's respected daycare centers here, and I really would prefer to send my child there. But it's almost double what I'd be paying for an in-home provider at this point in my life. That's just not quite in our budget. And I also don't really have the option of not working because of me and my husband's chronic illnesses. We need 2 health insurances. Otherwise, our healthcare costs would skyrocket and be completely unaffordable. And so I wanted to ask both of you kind of more about the financial factors that impacted your childcare choices. Let's start with you, Natalie, since you've already kind of alluded to that. And just how did the financial worries or thoughts impact the decision you ended up making?
Yeah, and like I said earlier, just the daycare cost didn't suck up my total income, but it was still a very hefty amount. So obviously it can be just overwhelming at that cost too, because essentially you're just going to have to review your budget and figure out things too. Even especially from being at home, it's like we maybe not have the full luxury that we used to have of going out to eat all the time, or we had to definitely cut a little bit of certain categories in our budget to be able to make that work. And again, I'm very grateful that we were able to make that work. But it's a big shock, because it's just, you fully have to sit down and analyze what you can keep and what you have to cut out.
Yeah. Anna, how about you? How did financial thoughts impact your decision?
Yeah, I have a handful of thoughts here. I like how Natalie mentioned when she was talking a few minutes ago that there are a lot of financial factors that go into the decision. There's also all the other factors outside of finances too. Wanting to be a present parent, wanting to be able to take care of your child in certain capacities or be there when they need you, and also kind of the homestead and all the responsibilities that come with that. But wanting to do those things also kind of inversely have a financial impact. So I know personally myself kind of taking a step back and reducing my hours, obviously that has a direct financial impact on me. It is kind of slowing or reducing my personal income and growth and wealth. But on the flip side, it's providing more benefits to me and my kids and our house. And so it's kind of weighing those two things. And the financial impact of daycare is enormous. We're getting into tax season, so we have to submit all our statements. And one is how much you pay for daycare or childcare in a year. And that number, when we look at it every year, we have the conversation, is it worth it? Because it is, in some cases, more than in-state college tuition, which is just crazy. It's a necessity and we need to do it, but that financial burden is huge. And it's also a balance of cost versus quality. This is our second center in Norwalk that our kids are at. The first one, I will say it was more cost effective, not cheap or really affordable by any means. They're both, high quality centers, but I will say there was more teacher turnover, which probably had to do with kind of, low income. They just didn't seem as engaged. Kind of the educational plans weren't as robust. Even the center leader, there was turnover there. So we left and switched to a center, which we now pay more, but we are getting better quality. The teachers have been there for years. There's no turnover. There's like trust and happiness in sending our kids there, but the financial impact is huge.
Yeah, absolutely. And Anna, you shared with me that you work for a firm that's all women and your boss has been really supportive of your reduced schedule. Can you share the effect of having that supportive boss as you are navigating being a working mom?
Yeah, having that support has made such a huge impact emotionally, professionally, practically. It allows for work-life integration in some manner. If I didn't have a supportive boss, I likely wouldn't still be working. I just don't think I could take on that stress. And I'm really lucky to be in a workplace where everyone kind of understands that caregiving responsibilities are real and it's a necessity. It's not lack of commitment from me. It's just the season of my life that I am in. I do work with all women. It wasn't planned to be that way, but that's how our firm is organized right now. And two other of the leaders in my office, they have teenagers now, so they've been through the season of life I am in, which they have some empathy for me. I think that's likely not all the case at all with all employees and their leaders and their bosses. So I'm lucky to have that support. I also think it gives me kind of a sense of sustainability, or thinking that my career being in the workforce is sustainable. I'm present at work when I need to be. I'm more efficient, but then I'm also present at home when I need to be. And so right now we're making it work.
Yeah, I can imagine that understanding from people who have been through it before probably makes a world of difference in how you're able to navigate work. And Natalie, for you, kind of in the same vein, I know that there are often assumptions that mothers who stay home with their kids have it easy, which we all know that's not true, and that mothering is a very difficult job. Have you encountered that attitude since you began staying home? And what's your response been to that? How do you combat that kind of almost misinformation about what it is a stay-at-home mom does?
Yeah, I just know it is definitely the hardest job I've ever done in my life, to clarify. But I wouldn't say like my most direct circle I ever don't necessarily get those vibes, but I still think you probably see that sort of kind of negative connotation about the easiness maybe on social media, because you don't see all of the behind the scenes and when people post about them filming and like having meals with their little one. And but again, I just know that is definitely a stigma that needs to be resolved, because it is, again, the hardest job. But I would say again, that's not so much of a problem for me personally, of me hearing it per se, but I would say like later on, I think like that 6-month postpartum window where I think people kind of have this assumption that, I should say maybe it's a synonym like of easy, but like, the mom's got it. Like she's killing it. She's doing a great job. But sometimes I think at that really vulnerable time at 6 months postpartum is when maybe people kind of forget about the moms and like not really checking in as much. And it was just kind of a quiet phase in my life too, where I probably could have used a little bit additional, more community feel and people reaching out. I didn't necessarily hear from as many people then. So I would just say like still check in with your moms even 6 months, 12 months down the road, because it is just still so hard and we crave that human connection too. And again, it is like the hardest job, and We are always working from the minute the baby wakes up to when the minute the baby goes to bed. Like, we are just constantly go, go, go. And it's a very overstimulating job, but we make it work.
Yeah. And I wonder what your thoughts are about when or if you do decide to return to the workforce. A lot of women talk about that kind of resume gap that they have. Is that something that you're thinking about, or maybe that you did think about as you decided to stay home with your son?
Yes, for sure. And I mean, even just, it's still just something I'm kind of getting used to. It's almost like my new identity, and going back into the workforce, I still do fear because there's just so many things to learn, like AI or advancement of that, or like how would I jump back into the workforce as well. But I would love to when the time is right. But again, this is just the hard season of life where I want to be 100% focused on my son or my growing family. I would have to say, and I started reading this book called The Power Pause by Neha Ruch, and she was like a business executive herself, and she ended up staying at home, and that was not what she expected in her plan originally. And I found it just really just impactful to read, because I felt like I wasn't alone, that there are many other women who kind of go through a very similar workforce and career trajectory where that was my work identity for so long, for almost 10 years. And then to not have that anymore, it's just been a huge shock to this system. But overall, I would love to come back to it and almost be stronger. And that's kind of like her overall theme in her book too, that, you learn even from being a stay at home, that there's other things you can continue to explore. You can invest in different interests. Like, for example, for me, I still very much in group fitness and teaching classes, and that's hasn't changed before I got pregnant. So being able to keep that still fresh, and then start to maybe add that my regular career back in when the time is right.
Awesome. I love that. Well, for both of you, I really appreciate the time that you guys took to speak with us today. I know from personal experience and just knowing tons of working mothers that these choices are all really personal, not always easy to share, can encounter judgment from others, whether they intend to or not. And so I know we as women tend to compare what we're doing to one another to see if, we're, quote, doing it right or being good enough. So having these conversations really helps highlight how we're all trying our best to do what's right for our specific families and situations. So I just want to thank you for being vulnerable with me today and offering our audience the chance to see how these decisions are affecting families in real life. So with that, I'm going to pass it back to LaDrina to close us out.
Well, thank you so much to everybody who's taken the time to give us their perspective today. I think one of the things that just really resonates with me is that this is not just a quality of life decision. This is not just a personal decision. It's a decision that has a real financial impact, both on individual families, but also on our local economies. And so I think we need to be thinking about this more broadly and thinking about a solution-oriented type of approach. I hope that employers or bosses who are listening recognize that you can be empowered to be part of the solution. I hope that childcare workers who are hearing this message see and know that you are valued and that you are valuable. And I hope that we're able to move forward with thinking about our kids at the center of all of the decisions that are made, and those people who are going to be the future for our great state of Iowa. So with that, for our listeners who have joined us today, I want to keep you encouraged. I want you to remember to be bold, be brilliant, and be fearless. Take care.